The Ceribell Rapid Response EEG system is a critical care EEG which empowers bedside clinicians to quickly triage patients they suspect of having a non-convulsive seizure without having to wait for an EEG technician. The system consists of a single-use headband with 10 integrated electrodes, a pocket-sized EEG recorder, and a web portal for EEG review. The Ceribell system can be easily set up by any healthcare provider. Users simply need to rotate the knobs and press the plunger to prepare the scalp and deliver conductive gel before starting an EEG recording. Users have real-time feedback on the quality of each electrode connection. After completing the setup, users can review EEG waveforms displayed on the Ceribell recorder at the patient bedside. Simultaneously, the recorder also streams the data in real time to a HIPAA-compliant EEG reviewing portal. The Ceribell recorder also incorporates the brain stethoscope function. This enables any care provider to listen to the sounds of the brain and screen for seizures with high accuracy. Normal brain activity sounds flat and quiet, while seizures generate a distinctive rhythmic sound. To use the brain stethoscope appropriately, you need to complete a different module on the Ceribell training website. In this video, we will cover headband and recorder maintenance, annotations, skin assessments. If the blue LED is lit, the recorder is already on. A short press of the power button turns the screen on and off. Verify that the record and Wi-Fi icons on the screen indicate that the recording and Wi-Fi are both on. You can check the recording status at any time by touching Home and then Record. Support the patient's neck with 1 or 2 rolled towels to create a space between the back of the head and the pillow. This will minimize the pressure from the headband electrodes on the patient's scalp. Make sure the headband is centered on the forehead and positioned right above the patient's brow line. Slide the rear portion of the headband down so that it fits at a downward angle just above the ears. Ensure that there is space between the back of the headband and the pillow to prevent excess pressure on the posterior electrodes. If an electrode connection becomes poor during a recording, the device will display a message prompting you to check the electrode connections. The device will still record even if there is a poor electrode connection, but it is best to fix the connection as soon as you notice the prompt. To fix the connection, touch the Pause Recording and Check Electrodes button. If an electrode connection is good, it will be displayed as green. Red indicates a poor connection. To fix it, rotate electrode 3 5 more complete rotations. One complete rotation consists of both the clockwise and counterclockwise turns. This allows the electrode to part the hair and clean the scalp. Make sure that the electrode remains in contact with the scalp during the rotations and only gentle pressure is applied. And then squeeze the plunger further to dispense any remaining electrode gel. Once all electrode connections are fixed, touch the Resume Recording button. Note that it is important to always check the electrode connections after moving a patient. If the electrode is still displayed as red after you've tried to fix it, additional electrode gel may be required. Annotations, or flagged events, are an important part of the bedside maintenance and management. If you suspect a possible seizure event or hear a seizure using the brain stethoscope, press the flag icon at the left side of the device screen. You can select from one of the following options: possible seizure, patient movement, headband being adjusted, stimulation, or other. Flagged events provide context to the treating physician during the recording. A flagged event should also be entered before turning and repositioning a patient and prior to skin assessments. Ceribell recommends assessing the skin every 2 hours after recording begins. Press the orange flag button on the left side of the recorder touchscreen. Then click Headband being adjusted. To check under electrodes, gently tilt the electrode back from the skin and assess the skin under the electrode for any non-blanchable redness or irritation. Repeat the same process as needed on all other electrodes. Return all electrodes to their proper upright position and check the electrodes page on the recorder to ensure that all electrodes appear green. If skin irritation is noted, reposition the headband slightly away from the area of irritation and make sure that the towel behind the patient's head is in the proper position and not pressing on any electrodes. The headband and recorder are not MRI compatible. It is important to remove the headband and recorder from the patient before entering the MRI room. It is also best to remove the headband and recorder from the patient during CT imaging, since they are radio-opaque and could interfere with the area being imaged. If you have any questions when using Ceribell, you can always call the Ceribell support line found on the back of the recorder.